In our morning rounds, a look at dramatic disparities in drug prices. Our continuing Bill of the Month partnership with Kaiser Health News and NPR examines unexpected medical costs. Today, we're highlighting one father's fight to get his daughter the hormone blocker medicine she needs for the right price. He was stunned to learn the drug costs 8 times more when used for children than for adults. Last summer, Sudeep and Sarah Taksali started to notice something different about their daughter.
She was developing a lot faster than what seemed appropriate.
Now 8 years old, she's already taller than her 12-year-old brother.
Just started to get the changes that you typically see for an older child.
Doctors diagnosed her with central precocious puberty, a rare condition that causes early puberty and can stunt natural growth into adulthood. Doctors recommended a proven treatment.
Some form of medication would be given to basically stop the hormone pulsing that was causing her to have early puberty. So basically kind of turning off that switch.
An implant placed under the skin turns off that switch. Every day it releases low doses of a hormone blocker. Taksali researched the 2 implants available to his daughter. One option, Suprelin LA, is a treatment FDA approved specifically for children with central precocious puberty. An implant for 1 year has a staggering price tag, $37,300. A cheaper option, Vantis, has a list price of $4,400. It's the exact same hormone blocker with slightly lower doses, but it's FDA approved only for late-stage prostate cancer. Both drugs are made by the same manufacturer, Endo Pharmaceuticals. In a statement, Endo said they are FDA approved for 2 unique indications, appropriate only for that particular patient population.
I'm looking at this big cost difference for no clinical reason.
Doctors we spoke to say the cheaper drug is just as effective in children. So Taksali wanted his daughter to get the less expensive option, but his insurer, United Healthcare, would only approve the more expensive drug, leaving the family with a higher out-of-pocket cost. But for this father, the problem goes far beyond money.
I feel like the patient consumer is completely blind. And I think it's just, to me, like kind of morally reprehensible. You're taking a predatory stance on families in need.
United Healthcare told CBS News in a statement, quote, "Our coverage policies are aligned with FDA regulations, and Vantis is not FDA approved to treat central precocious puberty. When the provider expressed concern over the cost of Suprelin LA, we worked with them to allow for coverage of Vantis." Dr. Elizabeth Rosenthal, editor-in-chief of Kaiser Health News, is here. Doctor, good morning.
Hey, good to
I don't think people can understand, and I want to know the reason why 2 drugs with the very same underlying active ingredient are 2 different prices.
Well, the simple answer is because drug makers can do this. They apply to the FDA for different purposes using the same active ingredient, and they call it 2 different drugs, but it is the same drug.
It's almost a $30,000 price difference. You're saying they do that because they can?
They do that because they can. So they're approved for different conditions, and that's why sometimes, insanely somewhat, your insurer will say, well, we'll approve the more expensive one, but not the cheaper one.
Do we know how much the family ended up paying for the less expensive drug?
Well, these things come in bundles, so you get it in, you get it implanted. So they ended up paying about $12,000 for the implant, which they were told with all fees would have been closer to $100,000 if they used the approved pediatric version, even though they were basically the same thing.
And is there nothing consumers can do? Because I like what you said, insanely, because it does sound insane.
Yeah, well, this consumer happened to be lucky because he was a physician and said, whoa,
but
that
for
doesn't
people,
make any sense.
Yes.
Yeah.
So I think what normal people should do is ask
normal,
is who don't have that background, ask your doctor, is there something cheaper? Sometimes, this is an extreme example. The adult dose may be cheaper than the pediatric. Sometimes it may be you've been prescribed a 500 milligram pill, which is expensive, but the 250 milligram version is really cheap, so you could just take 2 of those. So always ask the price of a drug.
But are the doctors obligated to tell you that there is a cheaper option?
They should. They should be looking out for you. They're not making money from these drug sales, so they should be looking out for patients.
It would be nice if they could make this easier for folks.
Right.
I mean, this is...
Oh, that's my mantra. Why do we have to call it investigative journalist or do research in order to just do the right thing, get the best price in health?
By the way, how is his daughter doing?
She's doing great. She got the implant in late January, and she's thriving, and they're already seeing some good effects. So it all worked out well for this family because the dad went
What do
the
you
extra
tell people
yard.
to do who aren't doctors, though? What should we do?
Ask your doctor.
Just ask your doctor.
Just say,
Simple
is
as that.
there a cheaper version of this
Right.
same drug that would work just as well? And often there is.
I didn't know if you could
right.
Google.
Yeah. I was going to say all's well that ends well, but I think
Well,
you'll be back with another bill next
Yes,
month.
Yeah.
Thank you,
Endless
Doctor.
supply. Thank you.
Thank you,
Elizabeth.
Supply. Or thank you, Doctor.